Thank you for your introduction. Because my student cannot be here, so I will present this work on behalf of him. So my name is Xihai Zhao from Tsinghua University. I do not have anything to declare. Actually, stroke is a big issue in the world, and previous studies have shown that coexisting intracranial and extracranial plaques are associated with ischemic stroke and recurrent stroke. It will have higher predictive value for future events compared with single vascular bed plaque. However, previous studies measured the coexisting plaques, either measuring plaque stenosis or the presence of plaque. So here we hypothesized that the coexisting intracranial and extracranial plaque compositions, especially the vulnerable plaque features characterized by lipid core or intraplaque hemorrhage, may have a higher predictive value for subsequent vascular events compared with stenosis or presence of plaque. So our purpose is to determine the relationship between coexisting cerebrovascular vulnerable plaques and subsequent vascular events utilizing MR visual imaging. In this study, actually, we recruit symptomatic patients with carotid plaque at least one side of carotid artery. And all the patients will undergo the MR visual imaging and for bilateral carotid arteries, and they will also undergo the intracranial time-of-flight MR angiography. So for the carotid plaque imaging, we used a standardized imaging protocol. So we will measure the intracranial artery stenosis and extracranial carotid artery stenosis. We also identify presence or absence of plaque compositions such as calcification, lipid core, and intraplaque hemorrhage or fibrosis rupture. So all the patients will be followed up for 1 year. The clinical outcome was defined as vascular events, including ischemic stroke, TIA, etc. And we will compare the cerebrovascular plaque features between subjects with or without subsequent vascular events, and the hazard ratio and the 95% confidence interval of coexisting plaques in predicting future events were calculated by using Cox regression analysis. So this is the baseline data. Actually, in total, we recruited 150 patients, and during 1 year follow-up, 39% of patients suffered from subsequent vascular events. Compared patients with vascular events, those without vascular events had lower smaller age, and the higher the use of lipid-lowering treatment. Compare the plaque features between patients with and without vascular events. We find that the patients with vascular events had greater intracranial stenosis and higher prevalence of lipid-rich nerve core in carotid artery. But unexpectedly, there is no significant difference in prevalence of intraplaque hemorrhage between these two groups. So for after the regression analysis, we find that after adjusted for clinical risk factors and carotid stenosis, we find that the presence of the carotid lipid-rich necrotic core, the presence of intracranial artery stenosis, and the coexisting intracranial stenosis and carotid plaque and coexisting intracranial stenosis and the carotid artery lipid-rich core are associated with the vascular events. Compare all these four hazard ratios, we can find that the coexisting the intracranial stenosis and the carotid lipid-rich core had the highest hazard ratio in predicting this vascular events. So these are the survival curves for coexisting plaque and coexisting the lipid-rich necrotic core, respectively. So here it's an example showing that a patient with coexisting intracranial artery stenosis and the carotid artery lipid-rich necrotic core. And this is the baseline data. We can find there is a stroke in the right hemisphere, but after 1 year follow-up, there is new stroke, new infarcts in the left hemisphere. So in discussion, actually, our data showed that the prevalence of coexisting plaques is near 60%. It's in the middle of the literature reports, but however, because we just measure the luminosynostosis in the intracranial artery, so our data may underestimate these coexisting plaques. So we found that coexisting plaques are associated with cerebrovascular events. So these results are consistent with previous studies. We also find that coexisting intracranial stenosis and the carotid lipid core had higher predictive value compared with the other measurements. So this result is expected because previous evidence showed that lipid core is a strong indicator for future ischemic events. Our study does have some study limitations, like we just use time-of-flight MR angiography to measure intracranial artery stenosis. So we do not have the visual imaging data for intracranial artery. Second, the follow-up time is short. So for this data, we will keep on following up all the subjects. Third, the size of lipid intraplaque compositions was not assessed in this imaging data. So we will do further imaging analysis. Hopefully, we will update all the results in the near future. So in conclusion, the coexisting cerebrovascular atherosclerotic disease, particularly compositional features such as lipid core, are independent predictor for subsequent vascular events. So the coexisting compositional features may have higher the predictive value for future events compared with just measure the luminosynostosis or the presence of plaque. Finally, I will acknowledge my collaborators. Thank you very much.